Has your dog had TPLO surgery and you're now at week 8? Your vet has given you the approval to move forward and let your dog run free? Well, stay tuned because today I'm going to give you 4 ways to help prevent the other leg from tearing because, as you know, more than 60% of dogs tear the other leg within a year. So welcome to Canine Wellness Online. I'm Tania Costa, and I own and operate Canine Wellness Center in Toronto, Canada, and I've been doing rehab for canines for over 20 years. Make sure you stay till the end because I have one exercise that I believe is the most important exercise to help avoid the other leg from tearing. Tip number 1, the paper test. If you've watched my other videos, I've talked about this before. So what I want you to do is go get a piece of paper and have your dog standing on the floor. And what you're going to do is put the paper underneath the surgery leg. And if you can pull that paper away super easy, it means he's not fully weight bearing on the leg. And why is this important, you ask? Well, that means if he's not fully weight bearing, he's relying on the good leg. And if he's relying on the good leg gets overused. I think that's one of the reasons that they have a tendency to tear the other leg within a year. So let's say your dog isn't weight bearing very well on that leg. You definitely don't want to go back to playing ball or jogging with your dog. You need a little bit more time and go back to some of the exercises like from week 7, week 8, and start getting your dog to try and trust that leg more. And it's probably not pain that's causing that, it's more habit. If you can't pull that paper away or there's a lot of resistance, then you're good to go. It means your dog is really trusting that leg. The second tip I'm going to give you is playing ball. So many of you by now have figured out that by playing ball, and I mean using a chucket, has more than likely led to your dog tearing its cruciate in the first place. And I hear so many owners say, but my dog loves the ball. So I'm going to give you a little idea. We know dogs don't care how far you throw it. It's really us wanting to exercise our dog. So what I would recommend is doing what I call dead ball retrieves. And what that entails is having your dog do a sit-stay and walk out 10 feet to start. Let your dog run to go get the ball from 10 feet, bring it back to you. And you can start by doing maybe 3 or 4 repetitions. You can increase this by doing more repetitions or longer retrieves. I really wouldn't recommend you using a chucket, but if you must, go for it. But just make sure that you start slow and gradually ramp up to your dogs playing with the chucket. So one exercise that I really think is important post TPLO, i.e. past the 8-week mark, is doing speed-ups. Now, we talked about it in one of my other videos early on in the process. But what I mean here, especially if you're somebody who jogs with your dog, is you don't want to go out and take your dog for a 5K run. What you want to do is start slow and maybe go for a 3-minute walk, then a 1-minute jog, a 3-minute walk, and a 1-minute jog for maybe 10 minutes. If your dog seems fine the next day, then you may want to increase that and do a 2-minute walk and a 4-minute jog and a 2-minute walk and a 4-minute jog for 10 minutes. You don't want to increase 2 variables. And the reason for that is because you want to make sure if your dog seems sore, which is more than likely muscle soreness, you want to see what the thing was that made that happen. So what I mean by that is if you do 2 minutes of a jog and 2-minute walk, 2-minute jog, 2-minute walk in a total of 10 minutes, the next day you don't want to go out and do 15 minutes of the same way. What's better is to do 10 minutes and do 2-minute walk and 3-minute jog and 2-minute walk and 3-minute jog for the same amount of time that you did the day before. And then you can increase the overall time. If you're not confused by now, well, good for you because I'm confused. The last and the most important exercise that I think every owner should do for months in some cases, and I mean some dogs 6 months, some dogs a year. I have dogs that had TPLO surgery 6 years ago and they still do not sit square. So the last exercise is sitting squarely. Because I know even at week 8, your dog probably in 90% of cases is not sitting with a square sit, i.e. using both legs equally. And the reason I say this is because if the surgery leg is sticking out a little bit, it means that they're using the good leg to get up all the time. So they're putting more stress on that leg. So you can watch one of my previous videos. And if you want to up the ante, in this video, I show you my dog. I had some puzzle piece mats and I raised them up. I started with 1/2 inch, then 2 inches, and built up. And you have the dog's front feet on those mats, and you try to get them to sit, or you try to get them to stand up with the front feet on that mat. The reason this can be really difficult is because they can't use their front legs to help them get up. So they're actually really using the back legs. And in my mind, with any injury, with everything, TPLO, hip surgery, you name it, this is key to a great recovery. Thanks for watching.